more people will join, or like, can we start?
Sir, sir, let me call them. Okay, sir. I had texted all of them.
Okay,
Sir, can
Nitin.
we take 2 minutes?
Okay. Okay, 2 minutes, fine. It's okay. Fine. It's okay.
Sir, all of us have joined.
It's just showing. Okay, iPhone. Okay, you are there. Nitin, Balmukund, and Janvi has also joined. Okay, fine. So we can start. Okay. I think Swati, that name was coming, but it's not there now. Fine. Let's begin. Okay.
Okay.
Okay, fine.
Sir, she's on duty today, sir.
Okay. It's okay. It's okay. I think you can just mute yourself and then we'll begin. Okay. Okay. So, welcome to this psychiatry resident orientation program. I'm Dr. Manish Roshan. I've done my MD from Department of Psychiatry at NDTC at AIMS, New Delhi. So whatever I'll be presenting, it is just the tip of the iceberg. Always remember, you can definitely read anything and everything. Sky is the limit. But this is the most important thing, or the topics that I have actually brought in and made it in a presentation, so that like this is what you can't afford to miss. Okay. So welcome to the residents of GMC Ernakulam, and also to Janvi. She is from AIMS Mangalagiri. And then we can begin. Okay. Looking into some of the raw truth regarding the psychiatric residency is, first of all, psychiatry is a very exhaustive branch. It's mentally very exhausting as compared to the physical exhaustion. Other departments, or you can look into your colleagues who are working in surgery, anesthesia, medicine. There also mental exhaustion is there, but physical exhaustion is too much. They can definitely get refreshing fast as compared to you, because they tend to get exhausted, but physically they'll be able to sleep for 6 to 8 hours and definitely they'll be again ready to work. But your exhaustion is chronic, long term, and ultimately affects the performance. It is one of the branch which is highly skill oriented. It is the toughest branch in medicine, believe it or not, but it is the toughest branch. It is not surgery or it is not medicine. You don't have anything apart from your words and the interview techniques. So it is something that has to be learned. Skill is the key factor which will actually make you a very good psychiatrist. Later on, if you see the learning curve, it is bimodal. You can learn a lot during your GRship, but learning continues till you have completed your SRship also. Okay. So learning in GRship is predominantly focused on, please mute yourself, all of you. So learning in GRship is predominantly related to the concept building, followed by examinations, and also it also depends upon what other skills you want to learn during your GRship. SRship learning is typically based upon your preference, your area of interest, and also the practice. That is the clinical practice. It gives you a more free hand as compared to what you are able to do as a JR. Finally, always in psychiatry, we do talk regarding the work-life balance, but believe me that work-life balance do come, but only after residency. It is nothing to be taken care of during the residency because, as you know, the working hours do extend, and it is not what people think that by 9 o'clock or by 8 o'clock, everything we wrap up and then we leave to our room. It is not like that. It is only expected that the work-life balance is the best, but only after residency. Lastly, if you look, reading as a habit is required as a psychiatry resident because firstly the subject is not at all taught in a manner as it should be taught in MBBS. Second, the exposure in all states, it is not the same. People here at AIMS will be able to see more number of psychiatry cases in as a MBBS student as compared to other states. So it depends, and it is not the same throughout the country. So, and also the subject is there, it is tough initially. So reading is a habit that is needed in this residency. Okay, so how a psychiatry resident should be? First of all, don't change yourself, be as you are. Rather, try to improve your skills and shortcomings. Always be patient. Don't be judgmental towards your patient, be it the patient of psychosis, be it a personality disorder, or be it just an acute stress reaction. Don't be judgmental. Otherwise, it will hamper your clinical acumen. You won't be able to learn. You definitely have to improve your observation skills. As I said, that it is a very skill oriented branch. You won't be able to learn if you are not able to listen properly. You are not able to observe. If you are in a hurry, you'll definitely gonna miss a lot. So be patient, be non-judgmental, just improve your observation skill. Always remember, leave your work in the wards once you are done. Don't carry out the things that you have discussed with the patient or you have discussed their life affairs, their issues along with you. Try to develop this habit because later on, when you are in your third year or when you are done with your residency, most of the thing, like most of the people do say that some things might have impacted them. It usually happens if you keep on thinking about whatever has been going on with the patient. Just leave your work, do try to think in a management basis whenever you are back to your room because relaxation is necessary. This is one of the key factor which actually lead to exhaustion, the mental exhaustion, that we keep thinking about our patient even after coming back from the ward. So make it a habit to leave all those thoughts there in the ward itself. The next morning, whenever you will be visiting, again those things will be there, but try to leave the things once you are completed your work in the evening. Next, this is very interesting because most of us do think that if we compare a psychiatric resident, you can either be Iron Man or can be a Batman. Definitely, the resilience should be there. However, at times you have to be like some of us are gifted, like Iron Man. We are able to use our skills in a better way. Some of the residents they do learn over the period of time. So don't compare yourself. Ultimately you'll be able to make the best out of yourself. So be patient, try to learn. You won't be able to learn in 3 years of residency. Believe me, you'll be only able to learn around 10 to 30% of that. Most of the learning will again occur when you do a senior residency, and the learning keeps on going. So don't compare yourself that okay, this guy is able to do the interview in a better manner. Rather, try to learn from your mistake and do improve on your skill. Definitely you'll be able to be at par with all of your residents. Okay. Finally, looking into the hierarchy, the clinical work takes the precedence above all these, the rest three, that is your OPD, the ward, and the follow-ups, followed by the thesis. Try to cover it on time or at par with your colleagues. If both the things are done, you can move on with your self-study, that is the textbook, the articles, and the presentation. I have kept it in a hierarchy of, that is the textbook comes first, followed by the articles, and followed by the presentation, because this is how it should be. Because textbook references are something which we should be well aware of. They are more authentic as far as a GR is concerned. SRship, definitely articles take the precedence, but as a GR, we should be well versed with our textbook. Presentation, which you can also see that a number of social media platforms are there in which they keep on sharing random presentations are meant only to serve the purpose of a particular seminar. Apart from that, the significance of presentation is not much, and they are just meant to serve the purpose of the seminar. So the learning that you get through presentation, or the time that you invest, it is better to invest that time in a textbook or in a classic article, rather than wasting your time on a presentation which is half baked, or it is not complete at all. Relaxation is very important. You can relax in any number of manner that you want. Daily, try to study for 1 to 1.5 hours. If not possible, if your clinical work is too much, focus on your clinical work. If you are able to make time, definitely try to study for a period of 1 to 1.5 hours or 2 hours at max. Please mute yourself. Okay. Next. So there are a number of resources out there in the market, number of books are there, number of articles are there. So it becomes very difficult for you to choose. So let's decide that there are some authentic sources apart from uh, the various other material that are available that we should be following during our residency. So coming to the book and the sources, first of all, these are the three talisman that we should be well versed with. That is ICD-10, ICD-11, and the DSM-5. So I don't know whether you're using a hard copy or not, but I used to have ICD-10 and DSM-5 along with me. Even if it is not there, try to have it in your iPad or mobile, but do always keep a copy of all these three with you, be it in ward, be it in OPD, or anywhere you go. Try to have a look at it whenever you are done taking up your cases in the ward or in the OPD. Try to look into the various criteria that has been given into each of these three respective. So coming to what is the important thing that you should be focusing on ICD-10 and DSM-5. As far as ICD-10 is concerned, always focus on the rubric, that is the heading under which a particular disorder has been mentioned. For example, schizophrenia, it is F20, but if you look into the heading, it says schizophrenia and other psychotic disorder. So you should be knowing that under what rubric it comes. Remember the F code, especially you have to remember it for schizophrenia, depression, BPD, OCD, anxiety, somatic symptoms, and stress-related disorder. Regarding child psychiatry and the personality disorder, gender dysphoria, as well as for substance use, definitely you can have a look, but these are the important 6 to 7 disorders that you can't miss at all. For child psychiatry, it's always better to read DSM-5 over ICD-10. Focus on the duration that has been mentioned in ICD-10. What happens, like in our ward and in our OPD, usually the patient, the total duration of illness is pretty much long. So we don't tend to focus on the total duration of illness that is required, the minimum duration that is required. Always try to look into the duration of illness that has been mentioned in ICD-10 as well as in DSM-5. More important in ICD-10, what has been given. Child psychiatry will again focus that in DSM-5, always prefer DSM-5 for child psychiatry. For example, if you read autism from ICD-10 versus if you read autism from DSM-5, you'll find that DSM-5 has classified it into various core symptoms. Two of the core symptoms are there, and sub-symptoms have been mentioned. These symptoms, if you know, will actually help you in two ways. Firstly, you'll be well versed with the clinical features. You don't have to read clinical features in that much detail because you are already knowing it. Second, your guidelines are already made. That is the diagnostic criteria, you've already known it. ICD-10, if you look, it is just in a form of paragraphs where the points are not mentioned. So child psychiatry, personality disorder, it is always better to look into DSM-5. In DSM-5, do look into the criteria. Apart from criteria, do look at the specifiers which they have mentioned. Actually, specifiers should be there as it is there in ICD-11, but DSM-5 specifiers are a must. Also focus on the duration. So if you want to compare like ICD-10 and DSM-5 for a particular disorder, focus on the Kaplan and Sadok synopsis, the 12th edition. They have given it in a beautiful manner. They have compared both ICD-10 and DSM-5 for each and every disorder, whichever they're mentioning. So open the textbook, look into that. They have given the differences. You can note down the key differences, which includes the duration, any core symptoms, and definitely the specifier will be always a differential because DSM-5 has mentioned it. Moving forward, for the first year, the psychopathology, psychopharmacology, and psychology. First, like looking into the psychopathology part, two of the books are there, Fish and Sims. And psychopharmacology stalls. Psychopharmacology definitely takes precedence overall. And CTP, the section on psychopharmacology is important. In psychology, any of the three books or any book that you want, you can use. I personally used Wayne Wheaton, and but it is upon your personal choice that you whatever you want, you can use it. But in like three of the things I have mentioned, that these are the three subjects that you have to study in first year. But always remember that clinics and wards are a must. Do attend your rounds, do attend the OPD, do various procedures like the RTMS or the ECT or the ketamine clinic, the CL psychiatry thing. Always be punctual in your work. Try to complete your clinics and things, because even if you skip the self-study part for a day, it won't hamper. If you skip your, like rather if you skip your clinical thing, it will hamper you a lot, because after residency there is nothing that will actually help you teach. Coming to the basics, always try to have these three books. Actually, the center one is not the book, it is the mental status examination. Do follow the pattern that is there in your college. The mental status examination, the higher or the neurocognitive function, look it from Stubb and Black. The chapters specifically that are there for neurocognitive function or higher mental functions are 3, 4, 6, and 8. For neurological examination, because staff is a very good book, and it definitely gives all the examination for all the system of neuro of the nervous systems in a very nice manner, and it's very lucid. You can easily read it. Coming to the psychopathology, two of the books are there. Although most of them they do like to follow Fish, Sims is also an equally good book. If you say that what are the important chapters that you can't miss at all as far as the Fish psychopathology is concerned, these are the four chapters: the disorder of perception, thought and speech, disorder of emotion, motor disorder. Whenever you are reading Fish psychopathology, focus on the classification that is given in the chapter. Like whatever the classification they have given for thought, whatever the classification they have given for emotion, or be it perception, always focus. Try to make the outline of the chapter. Like uh, most of us, what we do is like we keep on reading from the first line to the last line. Instead of that, look into how the chapter has been divided, and how and what are the various subsections that have been given in Fish. Also, what are the various specific symptoms or phenomenology that they have mentioned under each subsection? Try to make it in your notebook or in your iPad. Do keep it, because it will, at the end, it will help you in revising that chapter in a much more easier manner. Either write or highlight the definitions that has been mentioned in the book, because those definitions are like classical definitions. You can't mess with them. Apart from these things, important articles are also there that I have mentioned. Like in my group, that is Psych Reads, I've been discussing all these important articles, and the first five of the articles we have already discussed. I'll be sharing all these articles with you, like the thought broadcast insertion, SFRS, Insight, OCD articles we have already discussed in our group. But like these are the key 10 to 13 articles that you have to read along with your Fish psychopathology, because whenever if you miss thought broadcast, the examiner will definitely ask like what were the various definitions, what is the concept. That part is lacking in our textbook. Some part will be given, but with these classical articles it will become very easy for you. You'll be able to know, okay, like this was the background story, and these are the various concepts which led to these definitions. So this is why these classical articles are important for you. Moving on with psychopharmacology, Stall Psychopharmacology is a very nice book. If you look into the chapters that are being given in Stalls, 4, 5, 6, and 7, 8, 11, and 13, always try to read Stalls by starting with chapter number 4. If you start with chapter 1, 2, 3, it gets very much boring. Most of us will be feeling like, okay, these all things we have read in physiology also, then why we are reading it again? So whenever if you have confusion, you can go back to 1, 2, and 3, but always try to start with whatever you are seeing in daily day-to-day routine. For example, psychosis, schizophrenia, BPAD, ADHD, anxiety, all these things you'll be seeing it in your routine basis in OPD and in ward. Use this book as a book for neurobiology, because it has been discussed in very good detail, be it the receptor, be it the pathway, and the overall neuroanatomy part is also discussed, the various areas of involved in the brain. So these chapters which I have highlighted are a must to read. You can definitely go back and look into 1, 2, and 3, because if you start with 1, 2, and 3, it gets a bit boring and you tend to lose track. So focus on the diagram and the explanation. Read stall before reading a particular disorder. Like, it is good to read psychosis, schizophrenia from stall than reading it from CTP or any other textbook that you'll be referring to. Try to read it from stall. It will give you a wholesome picture. It will definitely give you a much clearer picture rather than going and looking up into the various other textbook. Also, the chapter 34, that is the biological therapy, that is specifically for the mood disorders, mood stabilizers and clozapine. It has to be read from CTP only, because mood stabilizers and clozapine have been described in a very nice manner. All the side effect and important interactions have been mentioned. That is there in CTP. So if we look into one of the pages that has been given in stall, if you look into both these sides, the right side and the left side, the right side definitely is the text, and the left side is the picture representation along with the explanation of the particular picture. If you look into the pictorial representation, the explanation is very nice and crisply described in just beneath the picture. So if you're having crux of time, if you don't have time, if you have very less time, and if you want to complete a chapter or want to have a look through the chapter, try to look into the figure. After that, do read what has been given underneath the figure. Rather than going to the text, you can just have a look throughout the chapter, just look into the figure, read the mechanism that has been given by the side of it. And these are all in a very sequential manner. If you complete the figure and the description, and then when you look into the text, you'll find that the text is just a bit more elaborated description of what they have been telling in the figure only. So if you have less time, if you don't have time, try to look into the figures, look into the explanation that they have given, and then definitely you can refer back to the text whenever you are required. Okay. Now, apart from psychopharmacology, the ECT definitely is one of the important thing that you have to learn. It is a clinical thing. It is the rotation should be done in a very serious manner, because if you miss it, you won't be able to learn ECT anywhere. These are the two important books that you can refer. The first is by Nimans, the manual, and second is the Royal College of Psychiatrists manual. If you say that what are the 5 or 6 important headings that you have to read under ECT, that then I have listed it there: the mechanism of action of ECT, the maintenance treatment, continuation treatment, role of ECT in pregnancy, the various side effects of ECT, and catatonia. Regarding the second book, which I have placed here, that is the Royal College of Psychiatry Guidelines for ECT, don't try to read the whole chapter. If you read the whole chapter, it might take long time. But if you want to have a gist of the chapter or summary of the chapter, the best part is that they have summarized all the guidelines and important points from the chapter at the end of the chapter. Like, for example, if you open the chapter on catatonia, you'll find that the chapter is 10 to 12 pages long, but at the end of the chapter, they have given 10 to 12 points which are must to know for that particular chapter. So if you want to have a quick overview, the role of ECT in catatonia, how it should be initiated, for how many sessions it should be done, how to do the maintenance and the continuation treatment of ECT, like in the case of catatonia, visit the chapter, open the last page of it, and there you are with all the guidelines. That part is not there in Niman's manual per se. They have given it, but it is very vague and very loosely defined. But in this book by Nicole Ferrier, he has been mentioning it in every chapter, for even like for schizophrenia, catatonia, bipolar, suicide, what are the various guidelines. So you can just have a look at it. Coming to the other years, that is the second and the third year, there are various subspecialties in psychiatry, be it adult psychiatry, child, community, forensic. In adult psychiatry, definitely there are a number of books. Top 3 or 4 books I have mentioned, that is CTPs, followed by Synopsis, Taskman, and Oxford. In child psychiatry, Synopsis definitely takes an overhand over CTP, because CTP definitely has mentioned a lot of things. But if you look into Synopsis, the child psychiatry part, they are very much specific and have grouped it in such a easy and lucid manner that you'll definitely read it in a go. And it has also compiled all the important studies in child psychiatry that we have to read. So Synopsis is very easy to read as far as child psychiatry is concerned. And so it takes precedence over CTP in the child psychiatry section. In community psychiatry, Niman's booklet for community psychiatry is there, and community psychiatry by B.S. Chauhan. This book is also there. Forensic psychiatry, again, you can look look for Niman's Forensic Manual or Forensic Psychiatry by Jiloha, or Nambi is also a book that you can look through. Addiction psychiatry, again, you can look into the AIMS NDTC manual, or you can look into the synopsis or CTP. Definitely AIMS NDTC manual is a good book, followed by synopsis and CTP. In the guidelines, you have to follow the IPS CPG guidelines. However, Maudsley will be discussing this particular book also in our presentation. Nice guidelines are all given in Maudsley. You don't have to search the net, keep on searching various uh, guidelines. Two most important guidelines that you have to know anyhow is IPS CPG guidelines, that is the Indian guidelines, and the NICE guidelines, that is the UK guidelines. APA guidelines, people do ask for schizophrenia and depression, but remember that APA guidelines are old guidelines. They have all been given in 2004 and 2006. So what has happened is like they're outdated. Still, if you want, and if your faculty ask, they are good to go for schizophrenia. Apart from that, they don't hold good ground nowadays. Bipolar disorder, apart from IPS and Maudsley, you have to read CanMat. Coming to the next, that is the consultation license psychiatry. AIMS consultation license psychiatry manual is there. You can also read it from any other textbook, but this book actually comprises of small sections, and it is very easy, and it has make crisp and comprehensive note of each of the topics. Neuropsychiatry, the issue with neuropsychiatry is there that in CTP, it has been mentioned, but again in synopsis, this portion is not there. So either you can look into Oxford textbook that is there in general, or you can look into Oxford neuropsychiatry textbook. Coming to community psychiatry, like these are the two important sources that you can refer to. First is the community psychiatry textbook by B.S. Chavan, and the next one is definitely a good to go booklet or the manual that was there by Nimhans. These are the important topics that you can't tend to miss in community psychiatry. And I have mentioned it that definitely whatever comes in your exam, do have a look at that. But these are the important topics that that you have to read anyhow. Be it the National Mental Health Program, the policy, the District Mental Health Program, stigma, disability, role of NGO, homelessness, and the psychosocial rehabilitation of psychiatry as far as community psychiatry is concerned. These are the important topics that you have to read anyhow. So these are must read topic in community psychiatry, and these are the sources. Coming to the various trials that has to be read, because most of us, what we do is like we came to know, we definitely have a we definitely know some of these trials, but what happens is like at the end of our residency, we are made aware of these trials that you have to read KT, Custless, STAR-D, STEP-BD. But what happens is like if you start reading from now onwards, you'll be easily able to know the findings, the outcomes of various trials. I have listed these important trials. Definitely you can read more than this, but these are like you have to know. Anyone, be it any exam, these trials which I have mentioned are definitely asked. In the trials also, you don't have to read the entire thing. You just have to focus on the year, when it was conducted, where it was conducted, approx number of patients, what were the various modalities that were used in each of the trials. Like for example, if we take the example of POTS trial, that was the pediatric OCD treatment study that was there. There, the modality was sertraline ERP versus placebo, only sertraline versus placebo, only CBT versus placebo. So these were the various modalities that were used. Always focus on the important outcome. More than the percentage, focus on the outcome and the key features. Like as I was talking regarding POTS, 26% of the individuals showed very good response with sertraline plus CBT. This 26% is not important. Rather, the outcome that has been given by the study, that is important. So always focus on the outcome. Don't be too much obsessive regarding the percentage. You don't have to remember all the percentage, because it will become very difficult to read all the to remember all the percentage of each and every study. So focus on the outcome, focus on the modality, when and where it was conducted. Coming to the various laws, like these are the important laws that you should be well aware with. As far as your college is concerned, or whenever your university exams are there, whatever law comes, it will be definitely either like all of them has been compiled in this. You can definitely omit what they are not asking, but you should be knowing these laws anyhow, because once you start reading this, you'll find that you don't have to remember how, when it was formulated, how it was formulated, what actually led to the formulation of this. Important sections of each law you should be knowing. Like for example, POXO, MHCA, that disability, rights of person with disability, CODPA, NDPS, these are all important laws and acts that you have to read in psychiatry. We all definitely come to know about these laws in our final year. Why to wait for that long? Just have a look of the important sections whenever you are reading that respective particular chapter. Forensic psychiatry, if you say that five important chapters that you can't tend to miss, that includes fitness to stand trial, euthanasia, the negligence, sexual abuse, and the forensic assessment. Apart from this, if it's your wish, it's your interest, you can read, but these five topics you can't tend to miss. Yeah, coming to the various studies in psychiatry, we all know that there are a number of studies that are being conducted. The classical studies have been listed here. We all have to know, again, as I have said, that there are a number of trials that we have to know. So the number of studies we also have to know. Important thing is that, again, we don't go and rush after the percentage. Rather, as I have said, when it was conducted, where it was conducted, what were the countries that were involved, and the outcomes. What were the important outcomes of each of these studies? Because anyhow, somewhere or the other, whether they ask the long term outcome in the course of schizophrenia, long term outcome in the course of bipolar disorder, what is the current status of the mental health issue in India, all of them have been covered by these studies. And a quick hack regarding, if you want to know the important points, so this book actually in second and the third chapter they have given it in a table wise manner. They have listed all these studies, they have given the year, the countries, the participants, the total number of participants, and the important outcome. So if you want to read in detail, definitely you can go and download the PDF of them. But if you want to have an overview of these studies, it is given in this particular booklet only. So just go and open, and you'll find that all these studies have been mentioned in this booklet, second and the third chapter. Coming to the guidelines, like as I said, for all topics, you have to know the NICE and the IPS CPG guidelines. For mood disorder specifically, NICE, IPS, and CANMED guidelines you have to know. For gender dysphoria, remember there is no such guidelines that has been given by IPS or by NICE. The only accepted guidelines is the WPATH guidelines. Download it, keep it there. If anything comes from gender dysphoria, that guidelines holds true. It has been followed at NIMHANS, at AIMS, and PGI. All of them, they are following this. Whenever the gender dysphoria cases come, it has to be managed in that guideline according to the WPATH guideline. For OCD, don't go for NICE guideline. It is again vague. Follow the IPS guidelines. For drugs, like if when to start, how to start, what are the various specific markers that we have to look for clozapine, look for the UK and the US guidelines, and for other mood stabilizer, definitely the IPS and the NICE guideline. Like for example, what dose and what are the various tests that we have to do, we have to perform prior to starting lithium or prior to starting valproate. All these have been mentioned in IPS and NICE. So for all the other drugs, look forward for IPS and NICE. But for clozapine, specific guidelines are there both by the UK and the US. You have to look for that. Apart from this, don't rush after all the guidelines. I've seen number of students, even myself also, we were all rushing after number of guidelines. At the end, it doesn't matter. What matters is that whether you know IPS, whether you know NICE guidelines, whether you know CANMED guidelines or not. If you don't know, there is no use of remembering and mugging up all the guidelines, because they in your clinical practice also you'll follow these guidelines only. Now, coming to this particular textbook, first of all, you don't have to become the master of CTP, Kaplan, and SADOC. You have to use it wisely. You have to read important and relevant stuff from this book. You have to complete your residency. It is not like that you keep on reading this book and ultimately you won't be able to do things in a manner that you are expected to do during the residency. So this habit that we usually have, like right from the first page to the last page, we'll keep on reading a book, that has to be left aside. Focus on important topics, the various good topics, and the relevant topics that has been given in this book. Don't be fearful of this. It is definitely a voluminous book. It is very thick, but what I am going to present in next three slides, like these are the important chapters that you have to focus on. Apart from those chapters, if you want to read anything extra from this book, it is good. It's your wish. Definitely you can read it, but these are like a must read chapters, or like these are the units that I have listed that you have to focus on: the neurocognitive disorders, psychosis, mood, dissociative, and the first unit, that is the neural sciences. And these are the various chapters that you have to look into. Like the neural sciences, these are the chapters. Unit 7 is important because diagnosis and treatment, they have given all their definitions, like for example speech, what is affect, what is insight, what is judgment. They have all given the definition in this chapter, unit 7. Okay. Whenever neuroanatomy is concerned, we are all looking into various parts of our brain. The important ones are here, like I have listed here: basal ganglia, thalamus, hypothalamus, limbic system, pappus circuit, amygdala, and reward circuit. You can't tend to miss any of these. So if you're reading neuroanatomy, complete these structures first, their relevance in psychiatry, and then you can definitely go on to read other topics. In neurotransmitters, read it under these headings only: synthesis, degradation, various neural circuits, their receptor, where from which nuclei they are being secreted, and the role in psychiatry. The important one, I have listed them here. If you don't want, or if you find it very difficult to read from CTP, you can go back to your favorite book, that is Stoll. Then when you open it, you'll see that dopamine you have already covered in chapter number 4. Glutamate you have already covered in chapter number 4 when you have read psychosis from Stolls. So it becomes very easy. So you don't have to keep on reading it from here. If you find it easy over there, definitely read it from Stoll. In Stoll also, they have given it under these headings only: synthesis, degradation, various circuits, and the receptors from where uh, on which these particular neurotransmitters act. So these two topics. After that, neurocognitive disorder, delirium, dementia, and amnestic syndromes, and schizophrenia. There are other topics of schizophrenia that are there in CTP, but most important ones I have listed them on your screen. And this is the last slide on CTP, that mood disorder. These 4 chapters you can't tend to miss: factitious, dissociative, suicide, and ethics. These are the 4 important unit or the chapters that you have to read. In psychosomatic medicine or CL psychiatry, you can read these 5 chapters from CTP, but these all chapters have been again given in the AIMS CL psychiatry manual. You can read it from there also. But accordingly, you can read either from this or there or from that book. Don't try to be a master of CTP. Read important, read relevant stuff. You don't have time. You have definitely, it's always a race against time. So utilize it in such a manner that you are able to read all those important stuff and you won't miss on anything. Coming to the note making, this is an important art that we all should learn when we are in psychiatric residency. First, if you want to make a note of particular topic, definitely give a read to it. While reading, mark it. Then when you're making note, write the definition of whatever you are reading. For example, if I'm reading specific learning disability, for example, I'll write the definition, what is meant by specific learning, write the F code. If you want to quote the epidemiology, quote it from CTP or the synopsis, and then the National Mental Health Survey, which was conducted in 2015 and 16. That is only survey which actually tells you the prevalence of various psychiatric illnesses in India. So if you're quoting for any of the psychiatric disorder, do it for quote it from National Mental Health Survey. For substance use, quoted from the AIMS NDTC study which was being done, that is magnitude of substance use study. I'll be sharing all these studies with you in your WhatsApp group. Try to quote the epidemiology from these 2 survey. If you want to quote the foreign uh, epidemiology, the prevalence, and the gender predisposition, definitely go for synopsis or CTP. Then, as I have said, read the diagnostic criteria for child. DSM, child, gender, personality, DSM-5 takes precedence over ICD-10 and 11. Rest all, definitely you can focus on ICD-10. Write the neurobiology under these 4 headings: neuroanatomy, neurochemistry, neurophysiology, neuroimaging. If any of the particular heading is not there, you can omit it, but do try to write it in such a manner. What will happen is, like, it will be very structural. You won't be missing on the next topic that is coming. Like if you know the neuroanatomy, the neurobiology part becomes very easy, because then the neurotransmitter or the physiology, it becomes very easy because those parts are well there inside your mind. The next point that comes is the differential diagnosis. followed by management. Always remember that we always forget to mention the non-pharmacological part. We are always in a hurry to mention the pharmacological management of a particular disorder. Rather than that, always focus on the non-pharmacological part. For example, if you are reading OCT, do focus on ERP, CBT, ACT, then read the IPS or the NICE guidelines accordingly of a particular disorder. But always mention, even for psychosis or schizophrenia, mention the PORT guidelines, PORT guidelines, that is there for non-pharmacological management, which includes family intervention, supportive employment, token economy, skills training, cognitive rehabilitation, cognitive remediation therapy, the assertive community treatment. Always try to focus on non-pharmacological part of management. It is equal that you should be knowing pharmacological part, but it is like we are all well versed with the pharmacological management. We always lack in our non-pharmacological knowledge. So take a note of it. While mentioning the pharmacology management, do try to quote or write it from IPS and NICE that has been given, and that we have to follow also. Okay. Apart from these topics, as I mentioned from CTP, from where you can read the rest of the topics, these are the three books that you can choose. You can choose one out of them. My go-to-go book is the Synopsis of Psychiatry by Kaplan and Sadov. One can also choose Oxford Textbook of Psychiatry. The language is also very much lucid over there. You can also look into the Alan Tussman book. Either one of them you can definitely choose. The only con of using synopsis of psychiatry is that the neuropsychiatry part is not there. Synopsis in Oxford it has been there, in Tasman it is there. So we have to read additionally Oxford for neuropsychiatry, but you can use synopsis. Yeah, coming to the next book, that is Mosley. It's very important book because NICE guidelines, it's there in your hand. All of the particular guidelines which have been mentioned in Mosley, it's all based on NICE. So you don't have to search for NICE guidelines in your net, or you keep on searching. So let's look into the various units that we have to focus on. Like these are the important units and the chapters that we can't tend to miss. Each of these units will be including the NICE guidelines, which are already mentioned in a very nice flowchart manner in Maudsley. Apart from that, focus on the long-acting injectables, refractory schizophrenia, how and where and what are the important tests that we have to look for before starting lithium, valproate, carbamazepine, and the various NICE guidelines for VPAD, rapid cycling, bipolar depression. Just give me a second. Just a minute, I'll be back. Yeah. So look into the various NICE guidelines that has been there for respective chapter. Don't try to complete this book also. Just look into the NICE guidelines. Look into the important topics which I have mentioned. If you get time, read the other significant chapters also. In addition, delirium tremens is very nicely mentioned in this book. The various treatment regimen, the lorazepam and the diazepam regimen has been nicely mentioned. Apart from the addiction part that we'll be definitely looking into, from like what are the important topics that you have to read, this book actually describes the management of delirium tremens in a very nice manner. Apart from that, substance misuse in pregnancy. Then child and adolescent, look for the guidelines of ADHD, tics, and the Tourette. In older people, that is the geriatric psychiatry part, dementia is very important. Management of dementia as per the NICE guidelines has been given. Important one is the behavioral and the psychological symptoms in dementia. This part has not been covered well in CTP, neither in synopsis, but Maudsley actually describes each and every symptom of behavioral and psychological symptoms that occur in dementia, their management. It has been beautifully described in this particular book. In pregnancy, look into the drug choice in pregnancy and what are the drugs that are there, whether you can prescribe it during breastfeeding or not. Last section, that is hepatic and renal. Hepatic and renal impairment, what are the various drugs which actually leads to impairment, or what drug you should be. Just a second. So look into all the drugs that are causing either hepatic or renal impairment. But there is always a catch when I describe these last unit. Don't try to mug up all the drugs. Read only those drugs which you are using in your OPD, which you are using in your daily day-to-day routine, be it in ward or be it in your practice, OPD practice. Always try to read those drugs which are used commonly. Don't go for the rarest of the rare drugs. Don't try to look into the hepatic and the renal impairment of those rare drugs. Like for example, you have to know lithium, there is no hepatic metabolism of lithium. Whatever lithium a person takes, it is being excreted out through renal route. So renal impairment is one of those important side effects that we have to look into when we are giving lithium for valproate, as opposed to clozapine and valproate. When we compare it with lithium, definitely metabolism of valproate and clozapine is there through hepatic route. Definitely you have to know that when you should be looking into and when you should be stopping valproate and when you should be stopping clozapine. So be logical, try to read only the relevant drugs, don't keep on mugging everything. Okay, so and also in hepatic impairment, for important mood stabilizers and important drugs, do try to read the CYP enzymes. For example, clozapine, the most important CYP enzyme is CYP1A2, followed by CYP2C19, CYP3A4, 2C, and followed by CYP2C9. So try to read it for important drugs only. Again, don't try to mug it up for any, like each and every drug. Except like apart from whatever I have been telling you, if you get AIDS patient, tuberculosis or hepatitis, try to read the interactions, relevant interactions of their medication, what they are on for these respective uh, illnesses, be it tuberculosis, be it hepatitis, be it AIDS, HIV AIDS, and read the relevant interaction whichever psychotropics you will be prescribing him or her own. Okay. Now, coming to the CL Psychiatry Handbook, that these are the important topics that you can do. Definitely, you can add and subtract according to whatever it comes in your university, but all topics have been given in a very nice and precise manner in this handbook. For substance use, you can use this handbook. It is very nicely written. Only the relevant points have been mentioned, and the management things have been mentioned in a very nice tabular manner. The RPT, that is the relapse prevention therapy, and the motivation enhancement therapy has also been given. So it is a very easy go-to-go book for substance use disorder. You can definitely supplement it with when you read it through your synopsis. It has been given in a nice manner in synopsis also. Okay, coming to neuropsychiatry, as I said, synopsis of psychiatry, Kaplan and Sadok, it lacks that this unit. But these are the important 5 to 6 chapters that you have to read for neuropsychiatry. You can't miss the neuropsychiatric manifestation of epilepsy, traumatic brain injury, Parkinson's, HIV, steroids. You can read it from Oxford textbook of psychiatry or Oxford textbook of neuropsychiatry, or if you have time, you can read it from Lishman also. Lishman, it is given in more detail, and the chapters are pretty much lengthy as compared to these books. But if you want, you can definitely read. So what if an individual is only having 4 to 6 months of residency and he or she has not read in depth or has not read at all, then what to do? Then definitely remember that the individual won't be able to form the concept. He or she might be able to pass the exam, but the concept will be weak. And definitely in your SR ship, you won't get time to build up your concept. GR ship time is there for building concept, for reading things. SR ship mainly depends on your practice. You will get a free hand, you will get a complete control of things to practice. So in SR ship, revision will be there. You'll be able to read more significant stuff in a much more deeper manner. But concept building should take place in jarship only. So gradually, when you read daily 1 to 1.5 hour, if you find time, you keep on reading this stuff, you'll be able to build up concepts, which later you can improve when you'll be doing your SRship. So what is the thing that if you're having only 4 to 6 months and then you don't have time to read, then these books come into the play. Tips manual is there and revision notes in psychiatry by Puri is there. This book is actually for the UK boards exams. So I've included it because it is good if you want to just take it as a note kind of thing. These books don't develop your concept. Tips per se is a very second and third grade book, which actually copies various type of guidelines and presentation. It is good if you are having your exams in nearby 2 to 3 months, when you just have to read a particular topic, understand it, and then you have to just reproduce it. It is not at all advised by me or by anyone. If you ask your faculty, they won't be telling you to read these books for concept building. However, if you want things to be in a precise manner, just for the exam purpose, you can look into either of these books. Even if you don't have time to read a particular topic, and if you have only 2 to 3 days left, or you just have a particular day only, then you can look into the CPG guidelines. If you don't have time to read your textbook, if you don't have time to read your tips or this particular revision notes, you can look into the CPG guidelines. Log into the IPS site, look into the guidelines, download it. If you don't read it from anywhere, it's my advice, read it from the CPG guidelines. 40 30 40% of the knowledge of a particular topic or a particular disorder, you'll be able to get it from CPG guidelines. That is why it is important. Again, the guidelines are there just to make you well aware of how the management should be taking place. It again doesn't build any concept, though it has given the various diagnostic guidelines, management guidelines. Concept building only occurs through textbook and relevant articles. Okay, now coming to psychology, you can definitely choose the book of your choice. I read it from Themes and Variations, that is the Wayne Wheaton book, but you can go with any of these. These are the important headings that you have to look into psychology. According to your exams, you can definitely alter it, but these are a must read: learning theory, attachment, and various other theories, be it of emotion, intelligence, motivation, personality, and some of the important figures, that is the Sigmund Freud, Erik Erikson, Jean Piaget, Thomas Jazz. These are important figures that you have to read about them, their contributions, and whatever important contributions and important concepts that they have given. Okay, for example, if you're reading theories of emotion, try to read only 4 to 5 important theories of emotions. Don't, you are not a clinical psychologist or you're not doing PhD. You have to know important theories. Rather than knowing all the theories, know important theories of all these 5 to 6 topics. Okay, while reading psychology, make it a habit to make notes, 1 to 2 page note of each of these topics, because at the end it becomes very difficult because there are multiple theories for all these important topics, be it for emotion, be it for intelligence, be it for personality. So try to make 1 to 2 page of note whenever you are reading psychology. Just those 2 pages will make you like, they will be so important at the end, be it for your viva, be it for your written examination, that you will definitely uh, thank yourself that you have done and made your notes beforehand, because it is difficult to read and remember and mug up all the various theories. So keep it there at one place, right there when you are reading. Biostats, these are the important topics that you have to read under biostats. Again, according to your university examination, you can add or subtract. I'll give you one of the Google Drive in which all the relevant articles of these particular topics are there. So you can read it. These articles are not lengthy. 2 to 3 pages articles are there for each of these topics. So it will be sufficient. You don't have to read any specific textbook for the same. And lastly, residency definitely is a long 3 years. You don't have to panic. Definitely use your creativity while you are interviewing, while you are discussing things with your patient, while you are handling a particular case or management. It is always an active, stepwise learning process. Try to build a strategy, because planning and strategy building is important. Do find time to relax, because as I said, that it is very mentally exhaustive branch. It is much more, it is the toughest branch in medicine. You won't believe me, but my professors, my teachers have told me, and have myself realized that of lately this is the toughest branch. People, your other colleagues might not agree to this, but residency is something that brings a new identity to yourself, and it changes your outlook. As I have said in the beginning, don't try to change yourself, rather work on your skills, your shortcomings, and try to become something that at the end of the 3 years, when you look back, you won't realize that changes that are happening with you. But when you look back after your 3 years, you'll be definitely seeing yourself that you are now a completely changed individual, much more calm, and much more responsible, and your outlook towards the world have definitely changed. Okay, this is my Instagram page. This is one of the kind for psychiatry residents. No one is doing it in India till now. This is the only page where I have given all the important topics from CTP for schizophrenia, mood, bipolar, depression, OCD, and other treatment important drugs. I have been posting it regularly. You can definitely follow me over there. If you are a member of the uh, WhatsApp group, this is the WhatsApp handle. You can definitely look for it. I'll share you the joining link. You can go every Friday and Saturday. We have an active discussion for an hour or two. You can take part over there. And beforehand, we'll be discussing all the specific and the classical articles that I have already shared with you in this slide also, and the various treatment regimen according to NICE, according to IPG, we have been discussing every week. So it's also the only active group where we don't promote the presentations that are floating all over the social media. The active and the authentic things are only taken into consideration. So with this, I come to the end of the presentation. We can switch on our cameras if you want. Hello, can you all unmute yourself?
So the
Yes,
class
sir.
was
Yeah,
so useful to us, sir. Like it is first time we are getting a complete guidance of all these books. Like
yeah.
we just know we have so many books, but like
Mm,
we don't know what to read from which books. So thank you so much, sir. It was really useful.
yeah. Any other comments anyone wants to make? Like any other suggestions that you can give it to me that you on which I could improve the presentation part? Like this was just to make you well aware, like these are the various things that you have to read. And if you want, you can read it through these sources. Definitely, you can choose your own source. You can make your own list of articles. You can make your, like, you can go through your way. But if you say that what is the basic minimal requirement that we all have to read in these 3 years, then these are those must to read topics that I have placed it all over in one place. Anyone having any doubt or whether they want to ask any question? I think like you can definitely turn on your videos if you want to. I haven't seen your faces at all. Look, so uh, I think other members are okay. So if you want to ask any doubt, the WhatsApp group, I won't be deleting it. We'll be continuing with the community. We'll be including all the various other colleges, individuals also there in the community. We'll add your group also. I'll post all the relevant articles and the books and the Google Drive link for the biostats, for the important psychopathology articles, all the books that I have mentioned, the PDF of them, along with some of my own notes that I have made it for drugs like antidepressant, antipsychotics. Those includes the T half, the maximum and the minimum doses, the important side effects, and the mechanism how they act. So keep those list, the antidepressant, antipsychotics, with you whenever you are doing your OPD. Try to keep it in your mobile. Try to look back whenever you are prescribing drugs. For example, even if you're prescribing fluoxetine, try to look what is the dose range in OCD, in depression. Till now, you must be knowing for other drugs. It is also mentioned there. Try to look so that whenever you are increasing the drug, the dose ranges, you are well aware of it. Don't be shy to open it in front of your patients, be it your ICD, be it your DSM, or even if you carry a textbook. Don't be shy, because once you start opening your textbook in front of the patient, you'll be whatever you read, it will be always there in your mind. You won't be able to forget whatever you have seen in front of your patient. So don't be shy. Try to learn each and every moment. Also try to relax. 1 to 1.5 hour of study daily is sufficient for a resident, because we don't get time. Don't panic. It was just an introductory one. Like I'm also preparing some of the lectures to in coming days to come. So I'll be letting you know regarding the same. Okay. I hope it was of some like I was able to give some direction to you. Hope you all have enjoyed your class and it was not boring, I hope.
No, sir. The classes were wonderful. Thank you for the classes, sir. I got a little busy at the end. That's why I
It's okay,
couldn't
it's
make a
okay.
comment.
It's okay.
Your classes were very clear how to study and all.
Uh-huh.
Thank you for the wonderful class, sir. Thank you.
Okay. I'll be sharing you the presentation, don't worry, huh?
Oh, okay, sir. Okay.
Okay, I'll be sharing you the all, so you don't have to, you can keep it there with you. Fine. So I think we can conclude the session now. Anyone wants to
Yes,
make
sir.
a and like any comment, they are most welcome to do so.
Thank you for the wonderful presentation, sir. It is really useful.
Okay. Thank you. Welcome. I think I'll so I think we can conclude now. Okay.
Thank you, sir. Thank you so much for all your efforts, sir.
Okay. Thank you, Jasmine, and all of you. Okay. All the best. Do try to get the best out of yourself. I hope we'll meet soon in the future. Okay.
Okay, sir.
Okay.